When we are working, we pay national insurance. Individually, you pay your national insurance until you reach a certain level of earnings, around about the £40,000 mark, and then you don't pay national insurance.
I left school when I was 15 and I started paying national health. Then later on I went to university and changed my job, and I've paid my national health throughout 50 years and never regretted one penny of it, to be honest.
Yes, I paid my stamp for my life, yes. Out of my stamp,
but
I also get unemployment benefit. I've never been unemployed, but I would get unemployment benefit. I get sickness benefit. All of that comes out of that stamp.
It's all free.
Because we pay for it.
Well, we pay for it through taxes, but as far as we're concerned, it's a service that's given via the government's taxes to us, and you can't knock it at all.
That everybody should have a chance, if they've paid into their national health, they should all have a chance to live, shouldn't they?
Far too expensive for what we do, and it's all bureaucracy. The hospitals are chaos, but then again it seems to work after a fashion.
We have 5 general practitioners who look after the population with the support of the staff. National Health Service in a form is provided across the board of all the population which is in our practice area, irrespective of their status. It's free at the point of delivery to the patient. We are generalists and we provide majority of the care for our population. Up to 80 to 90% of patients are dealt with in general practice. A small proportion goes to the secondary care, which is provided in the local district hospital. The patient like to see their own doctors and be followed up with the same doctor. And it does create a patronal relationship which can go through 2 or 3 generations. That means the GP may have a grandparent on their list and the grandchildren. So there is the continuity of the care. The National Health Service has been trying over a period of time to try and have a centralized computer system. The system we use is called System 1, and it was planned that all the practices in the country will be on the system so they can communicate with the hospital and different doctors, and when the patient goes in a different area, the people should be able to access that. I mean, this system is capable of being linked with all pharmacy, dentistry, and also with the hospital secondary care.
For the NHS.
Rubbish. That's complete rubbish.
Are we their country?
Yeah.
No.
Absolutely not.
I'm afraid I don't agree with that. It may occur in very extreme cases, but the big system is going to have its shortcomings anyway.
I work at a local retirement home. I think they get less attention than younger members of society, yes. It depends if the family are very supportive of the older person, then obviously they're going to get more attention. But if they haven't got family or they're not supportive, then yeah, they can get overlooked.
No, not really. They might not be treated very well, but they're not left to die.
No, I don't think that's true.
Absolutely without foundation, and the NHS has got a limited resource organisation. There is not unlimited funding. There is no limit, no rationing up to any age group. We can offer surgery to patients 80, 90 years old, with hip replacement, knee replacement, whatever surgery is needed.
Certainly not the case here. I mean, the idea is when you reach 70, then they say, right, well, that's it. You've had your 3 school years and 10. Now what? You know, do you want to go quietly, or no? nothing like that happens, does it? I mean,
No, I mean, you wouldn't get that sort of advice through the NHS anyway. If you wanted advice on whether you wish to make a living will or something, you'd go to a charity or you'd go to a solicitor. You certainly wouldn't go to the NHS. Sometimes when you go into hospital, you end up with life-changing decisions that need to be made. And an older person might feel pressurised. Whether they're being pressurised or not is a different matter, but they might feel pressurised. So we set up a service so that somebody could talk through the choices that they had with them for as long as they liked. So if, for example, they were unable to go home and they were being told, you have to go into residential care because you can't possibly manage by yourself, in the most well-meaning way they would be told this. We would get somebody to go and sit with them and say, well, you have the choice of being able to do this, but this would be the results of it. You could go to your own home and have a lot of care, but you would have to pay for it, and you would possibly only stay there for 3 weeks and then have this choice all over again. This would happen, that would happen. But you have these choices, and then go over that as many times as they like. It wasn't a service provided by the NHS, but it was a service provided with the encouragement of the NHS. So, and also with some of money from the NHS to provide that service.
There are millions of people treated in the National Health every year. And so, yes, of course, within millions of people, you're going to get a few isolated cases.
Mainly my dad, really. I mean, he was rushed to hospital with pneumonia, and his heart stopped, and they got him back again.
We hope that patients with cancer doesn't need to go to oncology, and they're picked up early and being treated without the need of further chemotherapy. But when it is needed, they are a system in hospital because they work as a team. The surgeon, the oncologist, and the histopathologist, they all have joint clinic meetings.
Every year, a minimum, is that the National Health Service, via your doctor, will give you blood tests and any other tests that they think is needed, regardless of whether you've got any And through the NHS, when they picked up the fact that I had a growth on my thyroid, it was only through a blood test they found out, and the thyroid obviously wasn't working properly, and then you have the scans and you have all of that, and it was brilliant because I wouldn't have known. I didn't feel there was anything wrong with it.